So welcome, everyone. It's great to be here. I know we're all quite zoomed out, especially at this moment in the pandemic, but we hope to make your joining us worthwhile today for this discussion. My name is Dreisinger. I am a professor at John Jay College of Criminal Justice and the executive director of the Incarceration Nations Network, a global justice network that operates across more than 100 countries. And we are excited to build with each other today on lessons learned in 10 years of LEAD in national and international contexts, an Incarceration Nations Network conversation. And I am quite genuinely excited about this panel for several reasons. One is that it focuses on an INN partner that is an incredible model and is, of course, a diversionary model grounded in public health. And this is what we really need to focus on if we're going to take on mass incarceration, globally speaking. We need to treat so many aspects of what we call crime as public health issues instead of criminal justice ones, and find ways to bring the human into justice. And simply said, stop criminalizing entire communities and particularly, of course, Black and Brown communities. And LEAD is such a powerful model for how this can happen. And given that it's been growing and evolving for 10 years, it's especially exciting for us today to be the beneficiaries of lessons learned in that long stretch of time. I'm also excited about this panel because it, like many panels in this conference, defies borders and national boundaries and takes us not only to the US, but to the UK and South Africa as well. And this allows us to not only learn about work happening along similar lines to LEAD in these countries, but also to reflect on the potential role of a program like LEAD there. And also, if our panelists see fit, to reflect on the issue, broadly speaking, of replicability as a whole. How do we implement lessons learned from one country into another, and what lessons sort of last as we cross borders in doing this work? And this is the essence of the work of the Incarceration Nations Network. As I mentioned, we have more than 100 partners across all continents, and we're really about learning global lessons across borders and boundaries and amplifying strong programs and practices from one country to another, and also to publics, to general publics across the world in order to make worldwide change in the justice space. And that is what we are going to do here today. So we begin with LEAD, with Najja Morris, who is the LEAD National Support Bureau Director. In her current role, Najja is responsible for providing national technical assistance and support to jurisdictions in all phases of the implementation of local LEAD programs, focusing on the areas of harm reduction, case management, and direct services. She also coordinates local LEAD operations in Seattle's East Precinct and is exploring potential for LEAD expansion in South Seattle and adjacent areas of unincorporated King County, in a nutshell. So Najja, please take it away.
Yes, thank you so much. I'm really happy to be here. And just to get started, I would like to kind of just do a reflection on the LEAD model and where it's taken us over the past 10 years. So to start, I just want to speak on, spend a little time talking about the origins of LEAD. And so for that piece, LEAD started in Seattle back in 2011. And it started after many, many months and actually a couple of years of negotiating between community partners, harm reduction specialists, the King County District Attorney, which is the county that Seattle sits within, as well as the Seattle Police Department. The reason the LEAD was even developed was because at that time in Seattle, there had been several years of over-incarceration, over-arrest, over-policing, specifically of Black and Brown folks in a very targeted area of downtown, just outside of the central area of downtown Seattle, in a place where a lot of people who were maybe moved there for Amazon or Microsoft were living. And what we saw repeated every night on the news was Black and Brown folks being arrested, sometimes even aggressively, and wrestled to the ground, and crack pipes being torn out their hands and then being charged with felonies because of their struggle with homelessness, poverty, and substance use issues and concerns. This came to the attention of the Public Defender Association, which was then led by Lisa Dugard, who is now still the director and is who we call the godmother of LEAD. And she became very alarmed that in a city that boasted, I say that jokingly, about a 6% African-American population, they made up over 60% of those incarcerated for nonviolent drug crimes in the King County Jail, which sat 5, 6, 7 blocks away from this area. They were being arrested on a nightly basis. So ultimately what happened is that Lisa and her team organization took the county and the police department to task over their practices, and stated their practices were racist and unjust and inequitable. And in order to prove a point, they did an action in which they had a handful of defense attorneys vigorously defend these low-level drug offenses as if there were high-level crimes, like someone who was affording a $500,000 lawyer. So they did all kinds of things, like they appealed every single thing they could appeal. They requested every single piece of document. They just plugged up the court system with these people and with these cases in order to show how ridiculous it was to be charging people with crimes that really needed a different response. So after a while, and I'll fast forward a little bit, everyone came to the table and we're kind of like, okay, so this isn't working. This is really heavy on our system. What can we do? What do you need to hear from us? What could we do? If we could do anything differently, and let's just say, for example, our practices are biased, what could we do differently? And at that point, everybody was so deep into the process of trying to make the point proven and trying to show how inequitable the system was, that there wasn't really a good idea at that time about what to do, but everyone just knew that a different response was needed, and that individuals that were struggling with particular issues related to mental health, substance use, homelessness needed a public health response, and were being too often over-criminalized and incarcerated. And not only was it impacting their lives drastically, but the lives of their family and their broader communities. And we've seen this time and time again, and we know and have heard the stories about ways in which specifically communities of color have been impacted by the war on drugs. So this is just another piece of evidence of that practice in place that was super harmful, and somebody was finally calling out the Seattle jurisdiction on that. So what happened was they decided to come to the table, and again, they asked the question, what should we do differently? Well, at that time, everybody looked at each other because no one knew what to do. It was kind of a shock of a question. So they all kind of like left the table for a while, and eventually what was decided was LEAD needs to be more, right? It's not enough just not to arrest people. It's not enough to just let people alone and just turn your backs on folks. So one of the things that they thought is that LEAD needs to be more, and LEAD is more, not less, is one of our founding principles of LEAD. And we believe that to say that it's not okay to just not do a bad thing, but you really need to replace it with a better thing, with a good thing, with a thing that makes sense. So that's how they came to the table. And because they were so closely associated with other harm reduction specialists and experts, they decided that the harm reduction approach would work best with this population. There's a few reasons for thinking that. One is because one of the premises of harm reduction is to first reduce the harm and approach people from a very humanistic perspective, meeting people where they are, letting people be the best expert in their own life, trusting people's thinking, and not treating people as a something or someone to be fixed. And what we knew to be true about this population that had been repeatedly arrested, and so, being deemed as so-called frequent flyers or high utilizers, we've all heard those terms as well, that these individuals had probably had many, many years of many, many people telling them what to do, how to do it, when to do it, why they need to do this thing to fix their life properly. And so this group of individuals was very sure that a new approach was needed in order to help support these folks that were being constantly cycled through the criminal justice system. So LEAD was based on the premise of harm reduction, low barrier, what we call guerrilla case management, which is taking services to the streets, going out and meeting folks, going under the bridges, going in the encampments, taking folks to doctor's appointments. The intent of LEAD is to absolutely not be office-based. There's a couple of reasons for that. One is because it's really super important that folks can see that they are mean enough for people to come to them, and that people always aren't having to show up on the provider's territory. One, because it really does set a power differential. And the other reason is because what we also know to be true is that trauma looks different for a lot of these folks, and having to go into these really formal buildings and see people in these rooms and see sterile offices and sit across from folks and answer a lot of questions about their life and what they've done wrong and all the ways they failed is not the way to reach these particular individuals. So they decided that it was going to be a low barrier, harm reduction, street-based outreach case management program, and that the police were going to be the ones to refer people to this magical thing. And so that's how LEAD got started, was that the law enforcement and the prosecutor, the district attorney, who's still there now, Dan Satterberg, all agreed to do this thing and give this thing a try. Because one thing they had to recognize and acknowledge that the stuff they had tried for years was not yielding a better result. Even though incarceration has gone up, specifically around low-level nonviolent drug charges, drug use has also shot up. It has not reduced drug use. It has not eliminated overdoses. If anything, it has just grown. So it was kind of like well, the other thing isn't, working. So we might as well do the better thing. So that ended up happening. And so in Seattle, they rolled out the program, and the officers were quite resistant at first. They thought it was silly. But as things started to progress, they started to recognize that this could work, and that this approach is actually allowing them to have different interactions with people. It's allowing folks to see them in a different light. They're able to get input on folks because they're actually able to communicate with the case managers. It's something we have called the operational work group, where it's kind of like a joint session of everyone kind of case staffing individuals. The prosecutors come, they discuss specific cases and what could be done to help someone move along or to help someone be successful. Some of the things that the officers learned was that there's so many things in the system that they thought could come easily that just are not the case. And there's so many things that they can't do that they can't get done in the criminal justice system that they thought the jail was helping with. That as they got to know case management and learn the case managers more and build those relationships, they quickly learned that the jail services weren't actually serving people at all. They weren't providing the public health response and the healthcare and the mental health and all the other supports that oftentimes officers honestly thought were being provided in the jail system. So after a while, they really became comfortable being a primary partner and making sure that there was support for individuals on the street. They were connecting them to case managers. They would even advocate for them in meetings. There have been many times where, because of the involvement of the prosecutor and the law enforcement program or the law enforcement agency at a site, that participant didn't lose housing. Maybe they were allowed to leave jail so that they can go into their housing, which sometimes has like a 30-day window, which is the longest you can stay gone before you lose your housing. I have so many examples of times when the collaboration between law enforcement, case management, and police, law enforcement and prosecutors have made it possible for individuals to actually make progress with their goals. Because one unique thing about LEAD is that people aren't siloed anymore. You don't have the law enforcement doing their harmful thing, the prosecutor doing their harmful thing, and then the case manager, service provider, not knowing how to communicate or let people know what's happening with an individual. One of the key pieces to LEAD is the collaboration. And it is the idea that people talk and come out of their silos in order to do the thing that's best for individuals, and that each individual has a specific plan in place and has a different response that is needed. And so this is how stuff got started in Seattle. And ultimately what happened is that around the country and even the world, people started to hear about this thing that was happening in Seattle. And that's how the Lead National Support Bureau ultimately got developed, was out of pure requirement, because there was so much demand for people to come visit, for us to train people. People wanted to know how to start LEAD. People wanted to know how to go about developing a program, getting funding, launching, operating. So then all of a sudden, out of nowhere, we grew from one site, and then within probably 3 to 4 years, we had 5 or 6 sites. And now at about the 9-year mark, it'll be 10 years old this October. So we're coming up on our 10-year anniversary. But right around the 8 or 9-year mark, there's about 50 or 60 sites around the country and more interest around the world. So we have interest from Canada and Vietnam, Malaysia, South Africa, and the UK, just to name a couple. And at this point, LEAD really has evolved. Like, besides, it started in Seattle. And one thing that's great about LEAD is it's transferable. The truth is the truth no matter where you place it. The truth is that individuals need a different response and deserve a different response. And that harming folks by putting them through the criminal justice system and incarcerating them for issues and concerns related to public safety and public health is not the way to go. It just does much more harm. And so one of the things we're most excited about LEAD is that it translates really well. So we have LEAD in big cities such as LA County, which is the biggest county in the country, and Baltimore, and Denver. And then we have it in smaller places like Cheyenne, Wyoming, and Alamosa, Colorado, and Ithaca, New York. And it's really great to see how people can tweak some of the pieces of LEAD and make it work for their population and work for their jurisdiction. The last thing I'll say about LEAD is it has definitely shifted with times. When we started LEAD, the goal was to shift policing and shift the culture, and to have law enforcement recognize that the space that they hold and the space that they take up that oftentimes creates harm or causes further harm and damage to individuals, families, and communities isn't actually a place they need to be. Law enforcement was never designed or trained or prepared to be in places where they're told to go and to intervene in circumstances that they're told to intervene in. Law enforcement is really about protecting us from very dangerous situations and people. It's not to respond to folks that are struggling with these issues around chronic mental health, homelessness, poverty, and substance use. And so one of the goals of LEAD has always been that as we move along this continuum is for law enforcement to see that there are other people that can step in and help people. There are other people that can hold that space and be able to have the appropriate response in the appropriate way in the appropriate time. And that coming in with force is more oftentimes than not the thing to do, and can be quite harmful, as we've seen time and time again shown across the news of instances where law enforcement really probably shouldn't have been in the circumstance, and that it could have really gone differently. Right now, we have always been moving towards wanting to incorporate community referrals and finding a way for folks outside of law enforcement to be able to make referrals and participate in this process to support individuals they see in their community that are struggling. And just recently, we rolled out another piece of LEAD, which we call Let Everyone Advance with Dignity, also known as LEAD 2.0. And what that is, it develops and creates opportunity for folks in the community to make referrals directly to the LEAD program. And the reason that is because what we know to be true is that community has eyes on and expertise when it comes to who's struggling, how they're struggling, and who these people are. And community does not need law enforcement to make those decisions or to be the gatekeeper or the determiner of who gets what services or who doesn't get what services. And it has been really exciting to be able to make that shift this year, especially due to COVID and the uprisings after the George Floyd murder, we've been able to roll that out in a number of jurisdictions that have found a lot of excitement around that and around the defund movement. And that is gonna really goes hand in hand with the reduction of resources needed to serve communities and not over police communities. So the hope is that as we continue to roll Let Everyone Advance with Dignity and the community referral pathway into LEAD around the country, that more and more police can back out of that space and more harm can be reduced. And we can actually be able to have community reinvest in each other and reinvest in people they see struggling and actually be part of the uplifting of folks that live in their area and that are, participants in their, in their economy. We're talking about people who, shop at corner grocery stores, at the bodegas, people that go to the different shelters and churches. It's going to be very exciting to see individuals be able to refer folks that they know need support and that they know are having a lot of unnecessary contact with law enforcement. So I'll stop there. And that is pretty much where we are with LEAD and how we have moved forward from being a primary law enforcement triggered public safety, public health diversion program, pre-arrest and pre-booking. That's very important to note that these are always before people touch the system. We don't, LEAD isn't about taking people out of the court system or having a pre-arrest or pre-trial diversion type of situation. And now we're to where we're moving towards more community referrals and having community members get involved in supporting people who are struggling.
So thank you, Najja. I myself have many, many questions, and I know our panelists do. And so at the end of this, after each panelist speaks, we're going to have time to chat amongst ourselves and anticipate audience questions as we are not live during this session. But I love this idea that LEAD is more, not less. And which brings to mind ideas about, the defund the police movement and not only focusing on what we're defunding, but thinking about what we are funding, not just what we're not doing, what we're abolishing, but rather what we're actively doing to replace it. Such a powerful concept. So we now move on we jump over to the UK to Pav Dhaliwal, Chief Executive of Revolving Doors Agency, a national charity that exists to change systems and improve services for people facing multiple and severe disadvantage and stuck in the revolving door of crisis and crime. So welcome, Pav.
Great, thank you so much, Baz. If you just bear with me a second, I will share my PowerPoint with you. Right, can you all see that? Is that a yes?
Yes.
Oh, brilliant. Okay, thank you. So thank you so much for inviting me to speak today. It's really exciting to be part of this. So to bring this into UK context, so I'm from Revolving Doors, and we're based here in the UK, and we aim to tackle the root causes of crime and come up with creative solutions. So we're focused on preventing the revolving door of repeat offending, and especially for those committing low-level and non-violent crime. The key to our approach here is working alongside people with lived experience of the system to understand their circumstances, conduct research and develop policy alternatives and services, with them leading front and centre. Our work with LEAD was born out of a growing evidence base that police are failing to identify vulnerable young people at the point of arrest. This is 18 to 25-year-olds in particular, and that police have limited to no options available to them to divert those young adults into appropriate support. So LEAD is the model that best reflects the services that we think are needed here in the UK. We're actively campaigning for increased use of diversion, especially for young adults, and a commitment from the police to do it. And we've called it New Generation Policing. Now, this is a growing problem. Almost 40% of all adults convicted are those with a history of repeat offending, the highest level ever recorded. The shocking thing is that theft and other low-level and non-violent crimes dominate the criminal records of these men and women. We're not dealing with serious organised crime here. We're dealing with crimes of despair, and we believe that are driven by entrenched poverty, a wide range of adverse childhood experiences, traumatic events in adulthood, and the impact of discrimination based largely on race, but also gender, sexuality, and disabilities, some of which we understand more than others. What's most striking is how quickly, for too many young adults, this becomes a revolving door of repeat offending. Over half of all reoffences committed by all young adults are theft and other low-level crimes. So not only does this draw into question the effectiveness of our current approaches, it begs the question of how much police time we are allocating to catching and convicting often vulnerable young adults. So this amounts to a complex and interconnected range of severe disadvantage amongst young adults coming into regular contact with the police. Many received free school meals, which indicates their levels of poverty in their household. Over 90% had at some point been temporarily suspended from school. 23% had been permanently excluded from school, and half go into adulthood on out-of-work benefits and are likely to remain on welfare rather than enter the labour market. Our system often thinks of people as having limited amount of chances. First-time entrants to the criminal justice system for low-level crime, they're given a second chance. Second and third time round, the system is less forgiving. But once someone has committed multiple previous offences, there is little the system has on offer to divert people into support. Short-term prison sentences are seen as the only viable option, which we know increase the likelihood of reoffending significantly in comparison to community sentences. A young adult with 11 or more previous offences is almost 6 times more likely to reoffend than the first-time entrant to the system. Yet we don't focus diversion efforts in their direction. This is a missed opportunity to really understand what is causing this level of offending and what can be done to slow the human and societal harm that is caused by both the crime and our policing response to it. We need to understand what young adults need from police and why they might not be getting it. Our research into the experience of people with repeat police contact makes for difficult reading. Firstly, the poverty they are often in is deep and all-pervasive. Secondly, the trauma they've experienced is varied and often exacerbated by police contact. People feel like they're being policed for being poor. They feel targeted, they feel labelled, and crucially, they repeatedly talk about a sense of hopelessness. People know that police have good intentions, but too often they don't have the skills or resources they need. In addition, we surveyed almost 700 young adults in the UK with some interesting findings. Firstly, most young adults see police as a force for good. So this is a decent platform to build upon. But, and this is a big but, the more they come into contact with the police, the less they feel that way. And the root cause behind why people are in contact with the police starts to become more apparent. Of the young adults in recent contact with mental health services, 45% were in contact with the police. 7 in 10 believe the police treat them poorly if they're from a deprived area. 7 in 10 believe that police treat them poorly if they are a person of colour. Vulnerable young adults with disabilities or mental health issues were less likely to have trust or confidence in police, and were less likely to think policing was fair or that it kept them safe. Crucially, the more often young adults had contact with police, the less likely they were to have trust or confidence in them. So how can we turn this dial the other way around? The answer, quite simply, lies in lead style approaches. We need to train police to recognise vulnerable young people. We need a harm reduction approach that police can refer to, that's not punitive in nature, that is community-based and focused on outreach, that focuses on addressing the root causes of crime and leaves behind the failed methods of punitive restrictive measures or the use of fines for people already trapped in poverty. We need a co-produced approach that brings lived experience into the heart of service design and allows the system to view the needs and strengths of people in the system in an equitable way alongside the risks they may pose. So we took the challenge to work directly with police commissioners and the police themselves. There was more interest in the work than we had capacity to provide. We chose 7 areas in the end, but we had interest from 19 out of the 42 police forces. There was and is excitement about lead approaches. The £2.5 million investment we have secured in diversion services is great as a starting point, and it's not bad for one charity talking to the police and local commissioners. All the services were inspired by lead, but none of them were ready to fully commit to lead in its original approach. But of course, we need to start somewhere. Our interactions with the police has been more about edging them forward to think about people who are in the revolving door. We're trying to move at their pace, but also nudge them along. For example, we need to push from tight restrictions on previous offences to allowing multiple offences. We need to push people from short-term 12-week interventions to long-term support. We need to push people from looking at supporting the greatest number of people to focusing on the greater need. We need local systems to own the lead model and to come to it naturally with some gentle nudging. We also need to get police to support each other, especially from different police force areas. We actually need acute focus on cultural change at the heart of police. Police understand the problem and they know they want to do something, but there's an attachment to enforcement in policing, which makes a commitment to police-led pre-arrest or on-arrest diversion a difficult concept to grasp. We bring people into police custody if they're non-compliant, and there is not enough understanding of just how traumatizing that can be. Police custody know these people. They know their names and they know their birthdays. And that's because their response to their crisis is to arrest them and to process them. What's the path of least resistance and how do we take that? We've noticed opportunities in the fact that there is less resistance to divert young adults, greater resistance than there is to diverting older prolific offenders, especially for use of Class A drugs. And there is less resistance to working with women, as the narrative that women are vulnerable has been more accepted, and men in this offending profile often have a history of domestic violence. Potentially, to make the radical change, the funding either needs to come from a very brave political position, but is more likely to be independent funding at the moment. So is there the bravery in the system to fund this directly? It's what we're currently working on. So I'm going to leave you with what is our vision for the future of new generation policing, which is a strategic focus on the root causes, bringing system leaders together with local knowledge, getting diversion up and running, this is crucial, and evaluating services to explore the evidence base, and widening systemic appetite for prevention and diversion. I look forward to the discussions.
Thank you so much. I just have a quick question, if you might touch on, you mentioned that there is hesitation on the part of adopting this model. I'm sure that that's a much larger conversation, but might you summarize what overall the voiced hesitations were?
Well, it simply goes back to diverting from the norm. They want people processed through the system. and they want to work within what the current framework is. It's so against the status quo to allow for what is essentially what Najja beautifully described as a guerrilla case management approach. They want everything that is processed. But having said that, we do see that there is a growing appetite from individual forces to do this, because, as I said, they know who these people are. They're not new to them. They know them really well because they've been coming into contact with them for many years. So it's really about that sort of changing mindsets and system change.
Thank you so much. We, yes, more to discuss in our after presentation discussion room. We head over to South Africa to hear from Sasha Lalla, a senior research assistant at the University of Pretoria, Department of Family Medicine, who are working in partnership with the local municipal government, City of Tshwane Health, Drug and Substance Unit, DSA, which we're going to hear about from Sasha, who as a result of load shedding is having a bit of some laptop issues and some laptop lighting issues in particular, but is going to share with us now regardless. Thank you, Sasha.
Can you hear me?
Yes, we can. Thank you.
Sorry, I'm just going to the start. Sorry, I thought it was already there. Just by the way, which screen are you seeing currently?
We see, it just says that you have started screen sharing.
Okay, so you haven't seen my screen yet?
Not as yet.
Okay, so let me just do this. Can you let me know as soon as it starts to share?
And thank you for working with us through the technical difficulties and the joys of load shedding.
Okay, is it working now?
Now, yes, we can see you. The
Okay.
screen.
Okay, so you can see the University of Pretoria sign. So thank you very much for inviting me to be part of this. It's really special. In 2019, I think it was November, December, Dr. Andrew Schreiber from the University of Cape Town contacted me, and he told me that there was an American organization wanting to develop a partnership on law enforcement and substance use. And I thought to myself, we've got the world champions of mass incarceration coming here. I know they'd been previously, well, there was a department in Chicago that was helping or assisting guide the governments, the local governments in the Western Cape on how to deal with gangs. So I was a bit worried, but I was pleasantly surprised to see that the lead model is something different and offer change to South Africa. From a South African point of view, I think we're different to the US and the UK in terms of we have a different dynamic in terms of our disenfranchised people, in terms of political standing, are actually in power, but the laws don't necessarily cater to them and often create challenges and hurdles for them to overcome. So there's a history to it, and unfortunately we haven't adapted as a society or as a country in terms of how we view poverty and how we police poverty. So probably the only place where apartheid style policing is allowed is in our disenfranchised communities who don't have access to lawyers to protect them from the heavy hand that the law can sometimes impose on them. So just to give you a background, the University of Pretoria and the City of Tshwane formed a partnership that is COSUP, and I'll just give you brief about how that took place. In 2013, there was a drug master plan that would go from 2013 to 2017. It was guided by the National Departments of Social Development as well as the Central Drug Authority, and then an interministerial committee on alcohol and substance abuse. And the city of Tshwane saw the document and what it was alluding to, and felt that it would be beneficial to create a program that would be guided by the core principles of the National Drug Master Plan as well as the Substance Abuse Act to tackle substance use in Tshwane. And they didn't have the expertise at that particular moment in time. And so they approached the university, and in fact, multiple universities, to do research and gather data on how they can tackle substance use in Tshwane, but also develop a model that will assist the local municipality in Tshwane in terms of tackling substance use. I think through the engagements with the University of Pretoria and other universities, they were able to link with the Department of Family Medicine in the University of Pretoria and sign a service level agreement in 2015. Politically, it was under the ANC government at the time. In 2016, they lost the local election. But fortunately, that didn't stall progress in terms of the formation of a model called COSUP, which would eventually tackle substance use. So just to give you a brief on the National Drug Master Plan, the vision of the NDMP is to obviously create South Africa free from substance abuse. And it would be guided by core principles and goals, which we will discuss later. But the key ones is evidence-based, rights-based, participatory in terms of people who are affected by substance use, in terms of them guiding their way out of substance use disorder, or also choosing the services that they would like to access, and hopefully help them on their path and journey to reduce harm in their lives. So these were the principles that we were alluding to earlier: rights-based, evidence-based, multi-sectoral, multilateral, and people-centered. The goals that guide the Drug Master Plan in 2013 and 2017 were demand reduction, supply reduction, and harm reduction. With regards to the partnership that the University of Pretoria and the City of Tshwane would form, there would be a focus on demand and harm reduction for the first 3-year period. And we are currently entering the next level of our service level agreement, where we'll continue to provide harm reduction services, as well as expand on the demand reduction services we offer to our community. And we would assist the police in supply reduction as best we could. This did create challenges for us, as law enforcement is guided by the law, and obviously as first responders, as the law dictates, they have to charge. But we're working on developing a better system with SAPS and the National Prosecuting Authority. So this is what I touched on earlier. Just to highlight, one of the reasons why the University of Pretoria was chosen is they had also been able to expand on community-oriented primary care, COPC, and they've done work extensively in the community to make sure that vulnerable population groups, disenfranchised population groups, had access to care through the COPC model. And so the University of Pretoria is spread across Tshwane in different communities to ensure that there's a pathway to health for all members of the community, thus reducing the burden of care on hospitals, because people are screened and assessed beforehand and followed up on a regular basis to ensure that if they need treatment, they receive it, but also through education, preventative measures are put in place that might assist them in the long run. Okay, what is COSUP? COSUP is an initiative between the City of Tshwane. I've touched on this. I just want to say within our team at COSUP, we have people with varying skills and qualifications. We have doctors, we have clinical associates, we have social workers and community healthcare workers and peer educators. The role of the team is to meet people where they're at. And the most important component of our team is peer educators. So they work in the community. They were once homeless themselves, once substance users themselves, and they will go into the community and link with the community and find out what their challenges are. The benefit of this is they also are able to link with our staff to teach us how we can engage better and expand on our understanding of how we engage with people, and encourage us to not always be biased against people who use drugs. And part of this new thinking that is currently being shared with many in South Africa. I know you guys have been doing the LEAD program for 10 years. Unfortunately, it's a journey we've recently started. And so often there is pushback because of a lack of understanding. So often our engagements with communities are to empower them through knowledge as to what harm reduction is and how it can benefit the community. We also have social workers who provide psychosocial support to help people access documents, IDs, grants, and IDPs, develop IDPs. We have community healthcare workers who, because of government legislation, are better equipped to go into schools, because people who use drugs aren't allowed to go into schools. And so therefore, when we do go into schools, we use community healthcare workers, and the community healthcare workers work with teachers to also encourage them to think differently on how to tackle substance abuse, to look for different problems, or look at the problems differently, rather than targeting the substance and the substance user, target the factors that might push the individual into substance use, and also develop and create a school that reduces harm as opposed to increasing the harm that an individual is struggling may face. Our social workers also guide the community health workers in this regard. We have clinical associates who work with the doctors in terms of dotting and managing other illnesses that some of our clients face. I think in America and the UK, they call them physician assistants or clinical associates. We're currently in 17 regions in Tshwane, or have 17 clinics in Tshwane. Tshwane is divided into 9 regions. Many of them are previously disadvantaged communities. I think apartheid specialized in out of sight and out of mind. And so often these communities were left with the bare minimum and left to fend for themselves. And so part of what we do in the community is try and ensure that we link as much as possible with different service providers, so that we can map and integrate and coordinate the healthcare that is available to the community through referral pathways, through collaboration, and even through problem solving solutions within the community. So we collectively tackle those issues. We also do that through an RDAC. The services we at COSUP provide, and this is something we've had to expand on as time has gone on, because we've understood the substance use problem better. We've understood that law enforcement, though wanting to assist, can sometimes be problematic. So we have expanded on this, and I'll expand on that later. But screening and brief interventions with our clients. So if someone wants to access a COSUP service, they go to the doctor, to the peer or the community health worker, and they're referred to a COSUP site. We do medical examinations. If a test is done, a drug test is done, it's done usually to confirm what the client is saying in terms of what substance they're using, because obviously sometimes in South Africa, not everyone is aware of what substance they have been taking. So it's good to know, in order to provide the correct service, we need to know what substance they're using on, especially where there's doubt. We counsel opioid substitution therapy, HIV and TB screening, social services, skills development, and post-rehab support services. The services that we've had to expand on is linking, and this is something we do in terms of advocacy, is linking with key government departments, so that when we tackle substance use in communities, there's support from the community and there's support from government. Often there's institutional misalignment with regards to what government is doing. And so the response, even though guided by the drug master plan, can sometimes be to incarcerate. And so many of our beneficiaries have faced challenges with law enforcement. I remember early in 2017, we did have a challenge which I'll get to. But just to give you a breakdown, for the 4 years that COSUP's been in existence, we've worked with different law enforcement agencies within South Africa, or people in the criminal justice system. We've worked with the South African Police Service, Social Crime Prevention, and Visible Policing, and they're the officers and the department we work with the most. And through them, we've been able to make inroads that we never foresaw. And it's been a great benefit to us, and I think to them as well, and they can attest to it as well, in terms of helping the community reduce recidivism in Tshwane. And obviously, at this stage, we don't have data on that, but it's something we see when local police stations phone us and want to refer, as opposed to laying a charge. And even during the COVID lockdown, where South Africa was completely locked down, the police asked COSUP to be part of their task team in Tshwane, so that we could make sure that all homeless people were placed willingly in certain shelters. Obviously, there were some policemen who, as soon as they saw a homeless person, they just wanted to arrest them and put them in a shelter. And we also had the challenge of many suburbs calling police when they saw a homeless person and wanting them to be moved, which is a challenge that we are trying to tackle through community engagements, but there are challenges presented because of the fact it is COVID. We've also worked with various police stations in Tshwane, 21 in fact. 21 in fact, sorry, am I still sharing?
Yes.
Okay, so 21 in fact, sorry, the reason why 21 in fact, sorry, something happened to my screen, so I don't know.
We are still seeing your the University of Pretoria, and it'd be great, in the interest of time, if you could wrap up in the next minute or two.
Okay, so sure. So with police, we've also met with crime intelligence, and this has been beneficial to us as well. Part of the work they did in the lockdown was assist in making sure that residents who didn't have IDs, who would like to get their IDs, would have access to the Department of Home Affairs to get their IDs. The National Prosecuting Authority is also on board in terms of the work we're doing. They recognize that criminalizing people isn't solving the problem. And so they want to work with the university in terms of providing the evidence to show and the data to show that harm reduction services and a lead type model would help benefit them, as well as the Hawks. We've been working with the Departments of Correctional, of Justice and Constitutional Development on a regular basis to help them, to guide them on dialogues on how to engage with people who use substances. We've recently undertaken a study with Johns Hopkins University and the Orem Institute, as well as the Department of Correctional Services, in terms of making services available for inmates and re-entrance into society, to help reduce harm in the prisons, as well as to provide support services after release. With the TMPD, we have faced challenges in that often, though they how do I call it, our brother program, because they're also funded by the City of Tshwane, their drug units want to arrest, they want information, and that's something we're trying to work on strategies to better support each other, but also to sensitize them to the challenges they create for many in our community. We created an initiative called Sports is Your Gang with the SAPS and with TMPD, where local police stations form sports teams with homeless people and people who use drugs and other key population groups, so that they see each other as teammates in this activity, but also teammates in other sectors. So when they do engage one another on the streets, it's not always such a violent engagement. Lawyers of Human Rights has also helped us to a large degree. But for us, the main solution is a law enforcement and assisted diversion in terms of the NPOs we have available. When we met with LEAD last year in March, there were various organizations and NPOs and government structures that engaged at the SAPS building, and they felt that it would be beneficial. And if it wasn't for COVID, I think we could have built on the understanding and the relationships developed to apply this model in Tshwane. I know there is a definite buy-in. I know the communities here need the service. I know South Africans who are over-policed also need the service. I know for the interest of time, I need to stop, so I will. If there are any questions, sorry, I know there have been challenges. I don't know if my presentation was sharing. I think you just saw the first slide.
No, we've seen it all. Thank you so much, Sasha.
Okay.
We did see all your slides. So thank you. And thank you for working through all of our technical difficulties today.
Sorry.
Can I ask you to stop screen sharing so we can see everyone's lovely face again, and also pass the hosting. Thank you so much. And pass the hosting duties over to our next speaker, who is Michael Wilson, also in South Africa, who is the South Africa Country Director and co-founder of Advanced Access and Delivery, a global health nonprofit organization with offices in the United States and South Africa. So we are thrilled to have Michael continue this conversation about South Africa and the harm reduction work and LEAD's relevance there as well. So welcome, Michael.
Great. Thank you so much, Baz and Najja, and to my co-panelists for the opportunity to share. You know, I think we're really lucky to be able to have this opportunity just to share, you know, experiences, but also to imagine communities that invest.
Sorry to interrupt, just jumping in, Michael, that if you are not on video, so if you wanted to show your face,
okay, sure,
we would love to see you.
All right. Sorry about that.
No worries. Much
great.
better.
All right. Sorry about that. Yeah, no, it's fine. So thanks so much. Yeah, so thank you so much, Baz and Najja, for making this happen. And I think it's been a great evening for us just to be able to both share experiences and programs, but also to kind of imagine what it looks like for communities that include police officers that are really caring for the needs of its most vulnerable. So I'm just going to go ahead and start my presentation, if that's okay. Okay, I'm sorry. Let's see here. All right, sorry, just 1 second. Okay, can you see that?
Yes, thank you.
Okay, great. All right, thanks. So thank you so much again. So I'm going to try to keep this as short as I can, but this evening I really like to speak about our experience in Durban, South Africa specifically, around police as protectors of harm reduction programs. And again, it will be kind of based on our experience. But just to talk a bit about the interaction between harm reduction programs and law enforcement, particularly in the last year during the COVID crisis. So just in my talk this evening, I want to give a bit of background. I know that some has already been said about the dialogue between law enforcement and harm reduction programs, but I just want to kind of give a little bit of background on that, and then just go into a little bit of an overview about the lead visit last year to South Africa, and then talk through just COVID as an opportunity, and how you know the COVID crisis has really created an incredible opportunity for continued dialogue, but also for some really incredible change over the last year. So just going through a little bit of background over the last couple of years, and I know that that there's been some of the background already discussed, and I'm not going to cover everything here. But prior to the lead visit in February of last year, there's been several engagements between the South African police services, the Metro Police, and those of us who are working in harm reduction around problems related to the existing performance-based targets, the very centralized system of policing that we have here in South Africa, that leaves for very little room for maneuvering. There has been sessions that were held between harm reduction organizations and the National Prosecuting Authority and members of SAPS and Metro Police, particularly when cannabis was legalized, around the discussion of police monitoring that. I've just put a picture here of Greg Denham from Australia, who is invited to speak at Drug Policy Week, which is organized by a colleague of Sasha and I's, Sean Shelley, who is the founder of the South African Network of People Who Use Drugs. Greg was a former police officer, and he gave a talk at Drug Policy Week called Policing in Public Health. And there was actually several follow-up days of engagement where he invited members of law enforcement to engage, to have peer-to-peer dialogue, mostly with police officers from Cape Town, to engage in conversations around the impact of drug harms and HIV risk amongst key populations, and the need for a more health, human rights-based response by law enforcement for key populations. Over the last several years, there has really been an emphasis from those working in harm reduction to include police in the governance of harm reduction programs. I know that the first community-based opioid substitution therapy program that was run together, that Dr. Andrew Scheibe and Professor Monique Marks ran together with TB HIV Care, that started in 2017, had members of Durban Metro Police on their board. There has been an acknowledgement that police are the experts in public safety, and trying to make the link between public health and public safety. So just shifting forward to the lead visit in February of last year, we began engaging with lead in early, I guess, middle part of 2019, and they so graciously offered to come to South Africa and were able to do a visit of 3 cities. So it visited Cape Town, Pretoria, and Durban, and really building on conversations that had been happening over the last several years that were really started by colleagues of Sasha and mine, including Greg, Sean Shelley, Professor Monique Marks, Andrew Scheibe. There was great involvement during that lead visit across all 3 cities, where members of Metro Police and SAPS had an opportunity really to engage with city officials, members of community-based organizations providing public health and harm reduction services, and also members of affected communities to really enter into a dialogue with one another, with the aim of developing a better understanding of each other's roles, trying to recognize where there are common purposes, where there can be alignment of roles and responsibility taken to reduce the harms, the drug-related harms and health risk, and to think about how do we fast track people into programs that can provide them with services that they want and that they identify that they need. And so just moving into lockdown. So South Africa entered level 5 lockdown not long after Lead was here. And we entered lockdown at midnight on the 26th of March. And here in Durban, 1 week prior to this, the deputy mayor who Lead was able to meet when they were here in Durban, called a series of urgent meetings that week with the city's homeless task team, which had been pre-established, to consider what the city's response was going to be to the roughly 2,500 homeless people that were living at the streets at the time, that the city expected would stay on the streets. And I think, largely because of the city's proactive response and this organized task team, which included representation from Metro Police and SAPS, including the Commissioner of Metro Police, Steve Middleton, the city was able to very quickly activate 12 sleeping spaces, safe sleeping spaces. 9 were located in the central business district and 3 were in the outer areas, but still overseen by the city and provided services by the city. And I think those of us who have worked in this space for some time really began to see COVID as a catalyst for fast tracking programs and services that had been in the works and been planned for some time to meet the needs of people that are homeless or people that use drugs in a very efficient and responsive way. I think just thinking to other things, there aren't a lot of things that are able to activate a government as quickly. Homelessness doesn't activate governments quickly. Lack of transportation doesn't. But in this case, a health pandemic was really able to. Procurement was fast tracked. The safe spaces, the organization of the safe spaces, the provision of meals to 2,200 homeless people. And so, not only was the activation of safe spaces and feeding, but a very comprehensive medical program, which I just want to share a little bit about, was put into place. So just based on research that had been done in 2016, we expected that roughly 60% of those who were entering the safe spaces would be experiencing moderate to severe symptoms of drug withdrawal. And that is very much what happened very, very quickly. And so those of us who have been working in this space with people who use drugs for some time really called on the government to respond. And to ensure that the lockdown regulations were adhered to, and to reduce the number of people leaving sites for drugs and then coming back and risking bringing COVID into the sites. The city supported us in starting a private medical program that was operational on 2 of the lockdown sites to serve as a medical withdrawal program using methadone to 260 people daily. And this in and of itself was an operational situation that we had to figure out as we went. And we absolutely could not have done it without the support of the city and without the support of the law enforcement, which actually became a very active part of this. So, the group that was running the program actually was a part of the daily VOC meeting that was set up, the command meeting that was chaired by the lead from Metro Police and SAPS, and we actually had a standing agenda item every day. And the police were actually involved in assisting in this program. As you can see here in this photo, we had a team of 3 nurses, we had a medical doctor, and then there was 2 of us who were kind of providing oversight and management for this program. But day in and day out, this program was protected by members of law enforcement, and the nurses were assisted daily by not only the setup, but as you can see here, the actual administration of the methadone to the recipients. And there was really a recognition of the integral link between public health and public safety, that the two aren't separate, and that to ensure that people are safe, we also must have a public health approach. And what we really had on our hands here was a paradigm shift in the government. There was, not only in the government, but also amongst members of the law enforcement, from a move from a prohibitionist stance to one of a harm reduction stance. And it was only, I think those of us that were involved really believe that it was only because of the effectiveness of the practice and how observable the change was in such a quick period of time, to public, to both the public of the city, who were very worried about what would happen to 2,500 homeless people and how would we deal with issues of withdrawal, but also to members of the police and city officials. And really in a very short period of time, they were able to see the impact of evidence-based programs. And so I just show this photo here. This was actually the gentleman in the center of the photo is the mayor of eThekwini, and he and the woman to his left is the deputy mayor, and they actually came to do a press conference at one of our lockdown sites where we were running the methadone program, to show their support for the program and to actually to recognize its importance in the city's response to homelessness during lockdown. And so the withdrawal intervention really created awareness amongst the community who were worried, but also amongst those in public safety. At the same time, I just wanted to mention that Durban's needle exchange program was also reinstated at the same time. And it was recognized that this was really done to reduce the further strain to the healthcare system. I just wanted to share this as with the support of senior officers from Metro Police, we were actually able to document how the police's view of drug use changed dramatically, again, from a more punitive to supportive approach. And there was this bi-directional relations that were that came about during lockdown between members of police that were on the sites where we were operating, and our nursing team and the recipients of the program. And so we were able to document this through a series of interviews that we did, and months of close observation and interaction with the police as part of the intervention, as they became advocates of harm reduction services and for people who use drugs, which was previously very controversial. And so we were able to write this up into a piece which has since received very great feedback from the Commissioner of Metro Police, who supported us in writing this up and conducting the interviews that made this piece possible. And so I just wanted to move forward just quickly, just to mention that when we moved to level 3 of lockdown June 1st of 2021, because of the positive outcomes from the program, the eThekwini municipality dedicated a building, it was called Belhaven Memorial Center, to the withdrawal management team for the purposes of running a harm reduction center. And to this day, we continue to run a program from Belhaven. The building has actually been changed its name to the Belhaven Harm Reduction Center. It is jointly managed by the daily runnings are jointly managed by the Urban Future Center and AA&D, with program and strategic support from the South African Network of People Who Use Drugs and TB HIV Care. Roughly every day, we have 200 individuals who come to Belhaven for methadone. And we also have naloxone and overdose training as part of this. This is actually a photo from 2 weeks ago where we did an overdose training with members of Metro Police. And yes, and we also have a program, just going back to what Najja said, we have a program that actually goes out to people that are too sick or unable to come to our program, to Belhaven. So we have a team of social workers and peer supporters that deliver TB medicines, ARVs, and methadone to people that are living on the streets and unable to come to the center. The arrangement with the Metro Police is negotiated, it's not imposed. And for the most part, the team at Belhaven is really able to police itself. We currently don't receive referrals from Metro Police, but we do have very good relationships, and we have, I say we don't receive referrals, but it's more we don't have a formalized system at the moment. But we do have members of Metro Police serving on our oversight committee. And again, we've done joint trainings. They participated in our overdose vigil that we did back in October to commemorate World Overdose Day. And yes, I think I just wanted to just mention that, there still is an inclination of police to arrest for possession of drugs, and we continue to see that, as there haven't been really a lot of amendments around the performance-based targets. But I firmly believe that through programs like Belhaven and the relationships with members of law enforcement that were established and strengthened during lockdown, I think that there's a lot of hope to formalize systems for referrals to programs, not only at Belhaven, but other harm reduction programs, and to continue learning both from cities here within South Africa, but also around the world. And that's why I'm so happy to be a part of this. I've, really, since I heard about LEAD back in 2012, have just really admired the work and the commitment to the communities where LEAD has worked, and their investment. And so, yeah, I'm very eager to continue to learn together and hope that, even despite some setbacks during COVID, I think we've learned a lot, and I'm eager to move forward and to learn more with you all. So thank you.
Thank you so much, Michael. Can I ask you to unshare your screen, and then we can move to a group chat. We don't have a lot of time, unfortunately. This is definitely a session that could benefit from many an hour of discussion. But it is heartening, very heartening to hear about all of this work being done. And it is also heartening to harken back to something Sasha said, to hear of a US export, namely LEAD, being a good thing in the global space, and not, I often talk about prison itself as a US export that has been foisted upon the world. And so much of the work that we at INN try to do is about exporting something beneficial, something progressive, something thoughtful, and certainly LEAD is one of those. And it's deeply inspiring to hear about the work that's happening. So I'm thinking for questions, we ought to perhaps just go around, and if we have any, ask them, and we can go, I'll start with my 2 questions. We can all note them down, and we'll go backwards from presenting. You can state your questions, and then we'll come back around, starting with Najja as our lead representative to answer. Does that make sense, team? Great. So I had 2 questions, and again, these are for everyone, but those who want to address them and take them on during your couple of minutes, by all means. One was, it's been referenced a number of times, the culture of policing, the culture of people's attitudes towards substances and use of them. How in your work do you take this on and try to turn around? Because we know that, you know, without shifting the culture, there is no real policy shift, and there is no change. And certainly we're talking about things like the systems of incarceration, of police forces, of public attitudes towards substances that have been ill-informed for centuries, really. So how do you take that on in your work? And the other is, and this is actually inspired by your last comments, Michael, on COVID. There was a lot of decarceration happening, and there was a lot of radical talk happening. And I know here in the US, terms like abolition became almost mainstream, or as close to mainstream as ever. Do we feel optimistic that that space for radical change is still opening? I know I've been very disheartened to see the numbers at Rikers Island, where I am in New York, back up to where they were. Many countries who are part of the network, India, for instance, reporting the numbers of incarceration being higher than they were as a result of COVID policing and so on. So how do we feel in this moment in terms of the space for radical possibilities, for diversion programs and alternatives to incarceration in light of COVID? So those are my thoughts. Maybe we can go down the line with quick questions, and then Najja will pick up with starting to answer. So Michael, do you have any questions?
Yes. So I would just say one of my questions is related to, you know, working in a space where there can be quite a lot of turnover politically. I think here in Durban we have had a lot of the success, you know, around COVID and the response to people, homeless individuals and people who use drugs, largely was a result of a very strong deputy mayor and a commitment. You know, obviously it's more than one person, but I guess just my question would be, you know, how have cities that have had some staying power, you know, sort of dealt with those issues of turnover with city officials? I mean, obviously it's about making it more than just one person, but that's something, you know, I think quite a lot about here in Durban. Yeah, so that's my question.
Sasha, did you have any questions for the panel?
Sorry, I was lost for a bit. Long story, but for me, I just would like to know how do you deal with, I don't know if I'm wording it correctly, but even in progress, even in one political party, there's always that pushback. So you make progress, you take 2 steps forward, and then within the same structure, and it's something we're dealing with within the city of Tshwane right now. Even though the partnership is there based on harm reduction, we're now finding that in this space, the people are questioning OST, even though it's something they needed in the lockdown. The city of Tshwane was wanting it to be available at every shelter. But with our high price of OST, it becomes very difficult for it to become a sustainable program, and therefore we face other challenges over and above that pushback. So how do you maintain that momentum? I don't know. It's not something that one can easily say it's good or bad. You just have this voice that's sometimes saying no, and it's not within us in terms of our own thinking, but from government structures, from the police to say, let's go back to the old ways. So how do you deal with that pushback? Because I'm sure it's prevalent in the States. I'm sure it's prevalent in the UK where people might say, let's go back to the old ways and see how it works there. It wasn't applied correctly.
Thanks, Sasha.
Sure.
Pav?
So yeah, my question, it follows on actually from what has just been said, and particularly what Michael covered in his presentation. So, of course, it'd be obvious that we would have this focus on COVID, given the fact that there has been lots of innovation in all of our respective countries in terms of pandemic response. So that's one thing. The same thing happened in the UK in terms of accommodation and support given to those people who are homeless, prescribing times for people in drug treatment services. So, of course, as lobbyists, as campaigners, we can, we are calling for the good innovations to remain and not for everything to go back to where it was. But going back to what we know are the root causes for people to enter crisis and crime, one thing that we know pretty much for sure as we're emerging from the pandemic is that levels of poverty are going to rise, and there is now an acute focus on health inequalities. So how do we all in our respective countries make sure that we influence that agenda to look for long-term reform, as opposed to the reactive stuff that we've all rightly been doing because of the pandemic response? But it's been shown in every country where COVID-19 has hit, certain communities are disproportionately affected. And so now all of a sudden, health inequalities have come into the mainstream in a way that they had never done before. So how are we going to be able to use that agenda to ensure that we can push for longer term reform outside of just the sort of piecemeal innovations that we've seen happening?
Najja, take it away.
Yes. Okay. Oh, I'm the answerer. Okay. So I'm going to start with Sasha and Michael's questions. They kind of overlap with each other. Michael, you asked about how cities can deal with turnover and how do you keep the spirit or the momentum going around these types of programs. That very much feeds into Sasha's question about how do you deal with the pushback. And the reason it feeds in is that a lot of the techniques are similar. I just want to say relationships. One of the things we believe in LEAD, besides more is more, is that LEAD is more, not less, is that relationships are the intervention. I know it sounds basic and kind of cliche, but in a lot of cities, building the appropriate relationships and taking time out to actually, we consider working with some folks. You have to work with everyone in a similar approach. So the same way you might work with folks who are struggling on the streets with poverty and addiction and homelessness, and you're meeting them where they're at and you're listening to them and you're validating their story and their experience. What we find is that works in every area of the LEAD continuum. So you have to listen to people who have concerns about their safety. People have stories. People have personal stories about maybe people in their life who have struggled with substances and caused harm to them and their loved ones. And so they have the idea of letting them go or not holding them accountable. Like there's this story and there's this narrative that happens. Also, getting momentum built with your base, with your businesses, any kind of business coalitions or biz chambers of commerce, your neighborhood coalitions, your citizens, because what we've learned again and again is the places that lead, and this kind of go into the turnover piece as well as Sasha, your question about pushback, is a lot of folks at the end of the day, they're hired, they're elected. If you have people that are calling for something and asking for something, and you have pressure from below, you have to utilize that momentum to put pressure on folks at the top to do a thing that their constituents are saying needs to be done. Also, law enforcement. When you build relationship with individual law enforcement officers, with some of the people that I met who were there, they also have the power to say, even if the chief changes or the operational staff or the higher staff changes, if you have the frontline people that say, we like a thing, we want to do a thing, this makes our work feel better and we'll be better workers and we'll protect the city more and be happier if you let us do a thing, people up high have to listen. Because if you think about the pyramid, You can't have hundreds of folks unhappy with the decision that 4 or 5 people made to remove a program that they say really helped the work they do. So so it's a combination. It's a combination of building relationships from the top down so that people can authorize and dictate and determine what needs to happen and put it into policy and practice. But don't forget that the base has a lot of power. The frontline police, your constituents, the business owners, the citizens, the community can also from the bottom up push to make things happen and to demand a certain treatment and to demand certain programs be part of expected culture shift and a culture change, and something that should not just be a special circumstance, but be the norm. One thing we've seen a lot in this country is that one precinct or area will have lead, and the precinct or areas next to it will be calling the council, being like, where's our lead program? How can they get this special thing? Police officers will be calling the captain and the chief of the whole department of the city. How can they get to do this thing? You know, because people talk, they talk to each other, they interact. How come my friend who works in this precinct gets to do this really cool thing and I don't? So I think that answers like both Sasha, how do you deal with the pushback? Is to also remind people the thing we did before didn't work. So people have short-term memory and people want to go back to what they know. And so it can be very scary to trust the thing. How many years did you do a thing that didn't work and you were only given this thing 1 year? So just call out to people the difference. How many times have you arrested that person and they're back on the street? Do you think arresting them a 38th time is going to work? So for some folks, you really just have to use logic. Also sharing stories, giving examples, having other law enforcement or other people that are peers who are for it, talk to them. Peers speaking to peers has power that we don't. Like we send our prosecuting attorneys or district attorneys in to speak to other district attorneys in areas. As a social worker, I don't go speak to them when they're having a difficult time or they're doing pushback because they know what I'm going to say. You're going to be the touchy-feely person. Of course you're for this. They want to hear other people that they feel think like them, that are going to tell them something different, that are going to give them a reason to do a thing that sounds, you know, outlandish to them. So those are the kinds of the things I think to do, is that you really have to figure out where your momentum is and not forget where a lot of the power lies. And sometimes it lies with just 2 or 3 people that spread a word and they have influence over others. Sasha and Michael, do you feel like that answered your questions around how to keep stuff going and how to like deal with turnover? Is that you don't invest all the way at the top, Michael. You want to invest in the middle and in the front facing folks.
Mm-hmm. Yeah, that's really helpful. Thank you.
Welcome. How to make sure we look for long-term response. I think similarly, like how do you, as you start to interrupt the space and law enforcement starts to be pushed out or removes themselves from this gap we're talking about where harm is done and where other folks need to step in, then that gives you more leverage to start thinking about sustainable funding and how to advocate for means and for partnerships that can come in and fill that gap. Because one thing about LEAD is that although LEAD has been shown to be cheaper than system per usual, it's not as expensive as it should be, right? LEAD with proper response and robust services and care coordination and housing and healthcare should actually be way more expensive. But ultimately the cost to the system is still much cheaper. When you think about the cost of the public health system to emergency services, to people who use the hospital as their housing, to all the indigent care, all those things are more expensive than housing. I think about this episode of one of my favorite, I don't remember what show it was. I think it's Amsterdam. And it's a drama, medical drama here in the United States. And he authorized this guy an $850 studio at the expense of the hospital. They bought him a hotel for a studio for the rest of his life to keep him from coming to the hospital because he was using it as his shelter. He would come in and complain 3-4 times a week. And that 1 year worth of healthcare was as much as 10 years worth of housing, essentially. And so you have to reason with people around sustainability and services that are needed to support these individuals and get people to realize that the way they're spending money doesn't make sense and is actually insanity. If you ever look at the bottom line, people do this real light touch Band-Aid approach as opposed to really wanting to invest in the long-term care and support and health of other human beings. And then, Baz, I think that the decarceration efforts, I think that, like you say, there was a lot of excitement and a lot of, as they say, hubbub about, when COVID first happened, and then when the uprisings happened because of the George Floyd murder that we all had to bear witness to. I think there was a lot of energy for it. And I think some places moved further along the continuum than others, but I do feel like things stalled a bit. I still feel like one thing that we don't want Lee to do is we don't want Lee to be the excuse or the reason why why departments justify not actually making culture shifts, right? Well, we got a LEAD program. We don't have anything wrong with us, right? We want LEAD to be the actual thing that creates an opportunity for law enforcement to do something different, do something better, and to remove themselves from spaces and not just be a distraction. Okay. And so when I think about the decarceration efforts and whether or not there's still that energy, I think that I think that it's different because there's so many, I feel like there are cities around the country where there is still a lot of energy and they tend to be the larger cities. And then there's cities around the country that we deal with where there was never energy to defund or defund or remove, abolish the law enforcement. Like we have some sites that we work with where they were not fazed at all by the activities around the George Floyd, because every political, environmental, culturally. So it really is going to depend on who is willing to put in the work and keep that door open and keep the fight going to make sure that these spaces where people deserve care and treatment and a public health response don't get once again overrun by a punitive response that's harmful to them and that isn't actually helping and that is really, really hurting. And the culture of policing and how to take on the shifting of thoughts and feelings. I feel like, so from my perspective, I think that we think about systems, we think about buildings, right? We think about these inanimate objects sometimes when we use the word system. So I think people throw this word around without really thinking that system is made up of actual individual human beings whose minds and hearts can be changed. And so when we try to tackle systems as like tackling a whole big monster, I think that's where we fall flat sometimes and where we don't have the impact we need. You have to be strategic and you have to attack individuals and groups of individuals that have power to make change. Because the people that make the change are the people that make the policies and make the decisions that change the system. So I think when people can actually learn how to communicate better and have better relationships with individuals, that's how systems change. Banging on a whole complete front door of a building does not bring down a building. You have to figure out who to pull out of that building, right? You have to figure out who might be the weakest link, so to speak, to that system that so strongly wants to hold on to its power and its harm, right? And that's who you have to look to. You have to figure out who has a relationship with the person that has the best relationship with the individual who signs off on these harmful policies. So we got to be a little more strategic about system change. And I think sometimes that we try to use a broad brush when we really should be using a very narrow brush and even sometimes charcoal or other types of medium to be able to draw within the lines and color within the framework of what these systems really are and what they're really made of. And really just remember, these are human beings that can respond to human feelings, they can respond to human contact, they can respond to human stories. And every single contact with an individual is a chance to change someone's mind, which is a chance to change the system. So that's what I really do think about in terms of how to start shifting culture. And the last thing I'll say is when we go around the country and do trainings, one of the things, hopefully nobody that I'm going to be in a room with is watching this because it's a trick of mine. When we do trainings, I specifically look for the individual especially law enforcement or prosecutors or other community members, who sits in the back of the room with their arms crossed. Because that's the person I want to talk to after the training, right? Because somewhere in this world, that person is one of the people that might be in touch with, or even be the person that has power, that actually can sign off on something or make a change in a policy that's impacting the system and hurting people. So I'm always looking for that person that's resistant, because the people that are friendly and want to do the work, they're not really the problem. They're good, they're ready. They're going to be our heroes. They're going to be our advocates. They're going to be the folks that are ready to roll with us. So I can talk to him after. But I really look for the people that seem the scariest. And those are going to be the people that are most responsible for the harmful systems that you're trying to dismantle.
Thank you so much. Other panelists, thoughts on any of the questions that were asked or response to those comments?
Daz, I was just going to come in with a really quick comment, just following on from Najja around culture change. I completely agree with you, Najja. One of the things that surprised me in terms of looking at the take-up from for the UK partnership of LEAD is actually it's the senior people who are bought in. So actually, the culture change where we're really having to focus on is then everybody else down the lower rungs of the ladder. And one of the things that always comes out really strongly from our members with lived experience of the system, they all say, well, they need to meet us. We want some FaceTime with them. They need to know who we are. We're not just people that they arrest, they come across during their working hours. We're actually human beings, as you were saying. So we're looking at, this has already started in some areas where people with lived experience are influencing policies, procedures, governance, but also where you really need to get people is when you're inducting them, when you're training young officers, training them in trauma-informed approaches, training them in the root causes that we were talking about poverty, about impact of deprivation, of adverse childhood experiences. And we are getting traction in bits of the system, but not that sort of wholesale reform. And one of the things that I was really reflecting on today, in particular, because as I sit here and speak, we've got protests going on all over the country, we've got vigils happening, and it made me think back to times where there's been sort of police brutality, and last year with the Black Lives Matter movement and how it played out in the UK as well. But ultimately, when you're part of a minority, so when we make up 8 to 10% of the population, it's like there's only so much change you can affect. Currently in the UK, we had a young woman who seemingly has been murdered by a police officer. When you're now talking about 51% of the population demanding change, and demanding respect from the police and questioning the police and their motives and the way that they're working, and also their culture. That then is where a time like people who are campaigners, who are lobbyists, need to come in and sort of seize upon that moment again, because all of these things are linked. It's about the people when you get them fresh, they're coming in and setting the culture from that point, not when they're 20 years into the force and asking them to change at that point, because they're so embedded within the system. And I think that we have to just take these opportunities as they come. But I was definitely sort of thinking about that, thinking, well, here we go. We've got over half of the population demanding some sort of change. So how can we make sure that this is not a lost opportunity for us to make sure that those voices are heard?
Thank you. We are over time, but if there's a last minute or two thoughts on any of those questions from Michael or Sasha, please jump in.
I was just gonna make one final comment. I think, Najja, your point about it really is all about relationships. I think what we experienced here during lockdown, and the shift that we kind of talked about, in kind of the minds or maybe the hearts of some of these younger police. I mean, really what happened was over the course of like 13 weeks, we had police officers who were spending time every single day in an underground parking lot with about 250 homeless individuals and just listening to their stories. And when, for this paper that we wrote, I did interviews with 10 of these metro police, and all of them were probably under the age of 30. And just hearing their, kind of before and after, and just the short period of time where this shift happened. And I mean, it's obviously it's not rocket science, like, you know, but it comes down to just creating that space for those relationships to happen. And they very quickly were able to kind of see, you know, the human in the person who was, you know, previously hustling on the streets, and they were able to see kind of their own family member in that individual and the human side. And I think, you know, something that they said was, you know, we're never going to have a large shift happen until enough of us are given an experience where we kind of have to hear each other out. And so, yeah, so I think something for us that we want to be intentional about is creating those spaces, you know, not just, creating spaces for relationships at all levels, but exactly like you said, it can't only be at the top. And thanks for saying that.
Sasha, did you have any last thoughts?
For me, it's been very beneficial to get to know what I would call the lead team, and I consider Michael part of that, and, you know, Najja. My thinking is, or what I've noticed is, on the ground in Tshwane, we've had a lot of buy-in from police officers and police stations on the ground. Our challenge is sometimes in terms of changing the policy that exists within our country, so that when police are required to respond, they're not the only option to respond. And so ideally, you know, I know in America and the UK, we talk about minorities. And so there is a conversation around racism there. In South Africa, I think the challenge is we are in power, if I can call it that way. And so our big challenge is we can even be defensive when we're accused of having racist policies. How can I be racist? And, you know, it's very difficult for some people to internalize that. They can get very defensive, and it's not, you know, defund the police. I think it's you know, it's a powerful movement. I think the one thing we're wary of sometimes here is to maybe not word it so strongly in the presence of police officers. So we talk about funding appropriately so that police can do the police job. And it's something, you know, we have to sometimes quiet the activists within ourselves so that we can link better with the policemen. It's not always an easy journey, especially with, you know, with senior police, where sometimes the general within them is, but it's not a criticism of them, because you do find that often they're wanting to link, but I don't know, that flow of information and will isn't necessarily being transferred to policy. And that's I do agree with Najja, I do agree with Michael and Pavan to say that relationships are part of it, but how do we take that next step, you know? And so that's something I'm hoping LEAD can guide us in going forward even better, to get that buy-in and to guide government structures, because I know they also want the support and also want the assistance. It's substance use affects us all, and poverty affects us all, and therefore crime can affect us. But if we come up with better solutions, I think we'll benefit society to a larger degree. But especially around the race issue, you know, it's very difficult sometimes to be able to engage someone on a policy that they don't fully understand themselves, can limit individuals, especially their own communities. So they think they're doing good, but often it comes at the expense of people who look like them.
Well, as I've said, we could go on. We've just opened up a whole other conversation, but let's hope there's a part 2. And I know that our relationships continue, those of us in this conversation, and we look forward to building together. And thank you guys so much. Thank you all for showing up and sharing and building in community.